Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Lofexidine. Its brand name is Lucemyra. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Lofexidine is a central alpha-2 adrenergic agonist. It reduces the release of norepinephrine and decreases sympathetic tone. In terms of indications for use, Lofexidine is indicated to be used in the treatment of opioid withdrawal. Now before somebody was to use Lofexidine, there are some precautions and warnings that they should be made aware of. It should be noted that hypotension or low blood pressure, bradycardia or a slow heart rate, as well as syncope, also known as fainting, have all occurred with the use of this medication. Dose adjustments may have to be made to counteract some of these side effects, and patients should make sure that they stay hydrated. There are a few instances where this medication should be avoided, such as coronary insufficiency, a recent heart attack, in individuals who have cerebrovascular disease, in chronic renal failure or kidney failure, as well as in patients who have bradycardia or a slow heart rate. Patients with congestive heart failure, bradyarrhythmias, hepatic or renal impairment, as well as electrolyte imbalances should be monitored closely while using Lofexidine, as there is a risk of QT prolongation. We should avoid the use of this medication in patients who have congenital long QT syndrome. We should also avoid using this medication with other medications that typically decrease blood pressure. Abrupt discontinuation of Lofexidine may cause a sudden rise in blood pressure, so the medication should be stopped slowly. Now, once somebody is made aware of the precautions and warnings and they start to use Lofexidine, they can expect to receive their dose orally, as it is available as a 0.18 milligram tablet. So if somebody is using this medication for opioid withdrawal, they would typically start off with 0.54 milligrams taken 4 times daily with about 5 or 6 hours in between each dose. They would do this for the first 5 to 7 days following the last dose of an opioid. The dosing would then be dictated by symptoms and adverse effects, and the maximum dose would be 2.88 milligrams daily. It's important to note not to exceed 0.72 milligrams in a single dose, and the medication is typically used for up to 14 days. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Lofexidine, so I'll go over some of those here now. Bradyarrhythmias can happen between 25 and 32% of the time. Up to 30% of patients may experience hypotension or low blood pressure. And orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position, may happen in up to 42% of individuals. Dizziness can happen between 20 and 23% of the time. Up to 13% of patients may feel sedated while using this medication. And 11 to 13% of patients may experience somnolence. Now, some more rare but serious side effects would be QT prolongation, fainting or syncope, as well as withdrawal symptoms. That's all we're going to talk about today with Lofexidine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.